Good morning, Dr. Arina.
Good morning, Dr. Cara.
Thank you so much for joining me today. It's so nice to have you here.
Thank you for having me today.
I'd like you to start, please, by introducing who you are and where you're from. I don't want to put words in your mouth, but you are a very special guest today.
Thank you. My name is Dr. Arina Pimoshenko, and I come from Eastern Europe, but I've been living in South Africa for many, many years now. And subsequently got honors degree in Pretoria in Onderstepoort in veterinary medicine and radiology, clinical pathology, and that didn't stop me going further along my road of special interests. And I've done advanced practitioner course and have postgraduate diploma in as an advanced practitioner in small animal medicine via UK, Harper Adams University. So, and still being a resident at Menander Veterinary Hospital and Specialist Referrals under mentorship of one of the leading specialists in the country. So,
sure.
Yeah.
A high achiever. Wow. So where did your inspiration start from? Is it like most young girls who wanted to be a vet? Where did it start?
It started at the tender age of 7, 8 years old.
Okay.
I wanted to become a vet or a dog trainer because it was despite things. Because I wasn't allowed to have a dog as a kid because we lived in the flat. Then when I finally had a cat, unfortunately he died at the age of 3 years old because he was fed commercial food. And it was like in the beginning of all the foods production started, and basically he died from some common disease at the time and easy treatable at these times.
Oh, that's so sad.
Yeah, so, and that was very sad for me, and I decided that when I become adult, I become a vet, and I will try save lives of animals. So little girls like me don't cry about it.
Sorry.
Yeah. So and then when I was in high school, I really enjoyed biology and chemistry, and that's basically formed my path to my career to become a vet.
It's opened up many doors for you. Hey? That's great. And so at what point was it at like final years of school that you decided to pursue veterinary, or?
Yes, final years of school. Yeah.
Okay, so just academically doing very well, and
academically, and I was considering also human medicine, but then decided that there's not as much compassion in that field as when it comes to animals.
Okay. And did you do work experience? Was there any particular thing that you did that made you decide this is my career path? I didn't do much work experience. I pretty much decided that I just wanted to pursue it in terms of veterinary career, and I really enjoy anatomy and looking into things, how they work in the body. So that's So an interest in sort of how things work. I think that we all feel the same when we that desire to know more and understand more.
Yeah.
Okay. And obviously you haven't just been a GP vet. Not that being a GP vet only is not a great accomplishment, but you've obviously pursued further and qualifications to just sort of get more sort of special interests and what's driven that?
Trying to understand how all processes working in the body, trying to help pet owners understand it, trying to get the answers where instead of just doing empirical treatment, covering a basis, trying to find the reason why the pet is unwell, and also being exposed to the world of veterinary knowledge and specialists and going to congresses. It was just very admirable and wonderful experience, and I thought it's really something that I would like to pursue. So that's one of
Well, it's very inspiring. Well done for
I know how much work it takes, so congratulations on
Thank
all
you.
that. So I want to tap into your knowledge. I think you are a wealth of information, and there's so many subjects we can discuss, but I particularly want to take a few subjects and really delve into it.
Sure.
Just to be able to show pet owners and just aid in reassurance and advice on how to manage certain conditions. So do you mind if we start with my dog's got a lump?
Absolutely. That's one of my favorite
Is it?
topics because we're working with lots of oncological patients.
Okay.
And oncology is often treatable and sometimes and many at times is curable. So the diagnosis of benign tumor or a cancer, it doesn't mean that we can't deal with it or we can't palliate or we cannot make the life of a patient better and improve their quality of life.
So what do people do? So they see a lump on their cat or their dog,
Yes.
and the first thing they obviously do is panic.
So if you see a lump on your pet, and if it is the size of a pea or larger, and it's been there for a month, don't wait.
Okay.
Aspirate. So you have to go to your vet, and then you have to ask, what they think that is, and then ideally the vet then should aspirate every lump, because just looking at the lump is not always, and I would say 95% of the time you don't know what it is. So aspirate is just a little needle injection into the lump, and then you get quite a few cells hopefully, and look under microscope. It's quite easy and quick procedure, and it's not painful. It's just like a normal injection when you take your pet to the vet.
So it can be done in the consult room.
It can
They don't
be
need to
done.
be sedated.
Well, unless it's a very fractious cat or a very distressed dog, but that is different conversation. So yes, the majority of pets tolerate it very, very well, and it can be done in your room, and it doesn't take a lot of time. And if the answers are uncertain, those slides also can be sent away to external pathologist, and you get your answers. And then once you get your answers, then it's much easier to understand how you need to deal with it.
Of course. And obviously reassurance for the owners, but also being proactive means that you're in a better position to do something about it if it is a sinister
Yes.
mass.
Yeah.
So assuming it's not, so say, your vet's saying, look, this is not a cancerous lump. What is your advice for it? Because often, it can be quite distressing for people, either because they grow big or they're there invisible and they're just causing a lot of uncertainty for a pet owner.
So if we're talking about benign lumps, then it depends where it is, and once again what kind of lump it is, because some benign lumps like mammary gland tumors, they can transform into malignant with time. So it's better to be removed. It's better to remove them and send them off to pathology for margins and so on. If it is a fatty lump, for example, a little lipoma, and your dog is full of it, and it doesn't cause any discomfort to the dog, and you can take an approach, wait and see. If it is little warts and moles, then, and once again your dog is full of it and it doesn't cause any discomfort, bleeding, ulcerations, then your vet might advise just to keep an eye on it.
Okay.
But if it is rather large, or it is somewhere in between belly muscles, muscle bellies, if it is somewhere where it causes discomfort, obviously it's better to be removed.
Yeah, because otherwise they may
Surgically.
self-traumatize and that becomes an issue in itself. Okay, and so delivering news that it is a sinister or malignant mass, do you find it difficult? Obviously I know that you see a lot of cases.
Yeah, well, you have to be open about it, but obviously you don't have, you shouldn't dropping a bomb on an honest. So ideally you have to have a quiet environment and get them seated and be open about it and tell them what you can do about it and then what options we have. If you calm, your owner will be calm as well about it. And then as soon as they know that they have options, then that's obviously that's how we have to deal with it. Yeah,
it's managing sort of expectations
Yeah.
and telling them prognosis, and
Yeah.
it's very difficult. And so, if it is a sinister mass, generally, there are options. Can you discuss some of the options open to people? Obviously, perhaps giving us an example of one of the more recent cases that you've had.
Yeah, sure. We'll have lots of cases. I don't know which one to pick up. But for example, if your dog has a melanoma and it's an oral mass, it is spreading like fire across the body. And the earlier your vet picks it up, and you can often pick up only during the thorough examination, which is why biannual or annual wellness examinations are very important. And the sooner you pick it up, the better the prognosis. Then there are ways to deal with it, as radiation, surgery, but it always has to be followed either by chemotherapy or a special vaccine. It's called onset melanoma vaccine, and basically it trains your body to not react to those cells, and then putting a stop, a break, a barrier to spreading of that tumor across your body.
Incredible.
And the prognosis without this vaccine is a lot worse than with the vaccine. So we were talking about a few weeks, months, as opposed to 18 months to 24 months.
Sure.
So, and if your pet is diagnosed with melanoma when they're already in their elderly age, so it's pretty much life expectancy, and there's no side effects at all with this vaccine.
So I think one of the major concerns from the clients that I speak to is they associate management of these neoplastic masses or diseases with chemotherapy seen in people, and they think, hair loss and vomiting and sickness, and quality of life is then a big issue. How does chemotherapy and radiation compare in our pets, and why?
So it is, you're right, it is a common misconception that chemotherapy is something awful for our pets and an awful experience, because it is like that in human beings. But it is not true. Many pets tolerate chemotherapy very well, and we know what side effects to expect from a particular drug, and therefore we work on prevention of these side effects. For example, if your pet comes in for a chemotherapy session, we know that we're going to give him antihistamine, we know that we're going to give them a anti-nausea medication before they receive chemo, and then for the following 3 to 4 days afterwards. If we know that this particular medication will cause the bone marrow suppression, then we do check bloods regularly and monitor for any side effects before they become a problem. Okay. So, and your dog doesn't know that it receives a chemotherapy. It's just living its normal life. It doesn't have this
psychological
impact that it has cancer. It doesn't know. It just lives the normal life and enjoys the normal life with you for as long as it's possible and at the best quality of life as possible. And if there's any particular patients that react to chemotherapy, then we change it. There's a lot of options. And then if you've started chemotherapy and you don't like something, you can always stop it, and we can always palliate it further. So it's not an obligation to continue. It's not an obligation to, and it's not something that will psychologically impact or physiologically impact your dog or a cat as much as it was in human being.
And now, a word from our amazing sponsors who make the Pause and Effect podcast possible. To make a promise implies trust. To make a pledge creates expectation. And to make a commitment initiates responsibility. For more than 25 years, we have made it our mission to take the ifs, buts, and maybes out of premium pet food. That's why our experts put the best science behind our food, so your pet's health is put first. That's why when you seek value, we strive to give you more, like protecting your pets with our free accident benefits. And when you need great tasting food, our fresh meat taste delivers. You see, what sets us apart is not one thing, it's all these things combined. Because we understand that when it comes to your pet's health, you don't want doubt and uncertainty. You want absolutes, the absolute best given your means, like premium veterinary quality food of real value that doesn't cost an arm and a paw. So rest assured that any claim we make, we stand by. It's our commitment to your pets and our promise to you. In fact, we're so confident in what we stand for that we have made the ultimate promise to you. It's called the Ultra Pet Promise, 100% money-back guarantee, a no ifs, no buts, and no maybes kind of promise. We call it our satisfaction guarantee. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Let's get back to our conversation on the Pause and Effect podcast. I mean, I suppose in the same breath, when we come across, say, a hind limb that has a neoplastic issue, or we have a major trauma and they have to have a limb removed, often people are very worried about the psychological impact, but they don't have the, like you were saying before, they carry on living their best lives, and they don't go, my goodness, I'm having to function on 3 legs. What is the dog next door going to think?
They actually accommodate themselves so quickly. It's amazing.
They're so adaptable.
They adapt very easily because remember, they don't have 2 legs; they have 4 legs. And they learn how to work and survive on 3 legs, and not survive, actually live normal life
and thrive.
As long as all other joints are obviously fine. Yeah,
absolutely. And I think that's quite reassuring, because I think people, often panic, and like you say, the main thing is to be proactive about it and find out what you're dealing with, because it may be benign, and if it is not, to work with your vet to manage and have good communication in terms of your financial and emotional ability to deal with that. So talking about expense and financial expectations, veterinary care is considered pretty heavy going by a lot of people. I think, I don't know about within your career, but I know from personal experience, there is often a expectation that we are in a position to do it for free because we care about pets.
Because we love pets.
And we should be compassionate. Unfortunately, most of us work for private practices, and we are running a business. Yeah. Can you give your opinion on veterinary care and explain perhaps why owners have to manage their expectations with regards to costs associated with treatment?
Yeah. Everything comes with a price attached to it, unfortunately, in the modern world, and including veterinary care, including good veterinary care. If you compare your pet to your family member, when you get sick and you get into hospital, there are costs. Private hospital, there are costs attached to it. So we do love animals, and we do perform with passion and compassion towards our patients, obviously. But there are bills that we have to pay at the end of the day. Running a practice is a big undertaking. There are staff members that you have to pay at the end of the day. There are suppliers, taxes. There's equipment that you have to pay off. There's veterinary council fees. There is municipality bills.
It's like running any business.
It's like running any business. Unfortunately, everything comes with its own cost. So, and if you compare the human hospitals and veterinary hospitals, we get sometimes the same suppliers for medical equipment and inventory, and it costs the same, not less, or sometimes it's even more if it is a patented animal product or a stomach tube that we ordered specially from overseas, and it comes with its own price. But for the comfort of knowing that it is going to be sterile, it is going to be new equipment, it is going to be modern. It's not going to cause discomfort for your pet, and it's going to be safe without any risks attached to it. But it is going to cost what it costs, unfortunately.
It's difficult. It is very difficult. And I think, I know certainly within our practice, we try and work with what people are able to do and not put any additional pressure on what's, a tough moment. But we all want to practice best medicine and give like all options, and having a discussion involves discussing the financial aspect of it. There's no way around it. So what can people do? I mean, how would you advise people go about trying to deal with things, particularly if something expensive comes up, where out of the blue your animals suddenly gets ill or gets into some sort of traumatic event, and they need to try and manage the bills associated with their care? Are there
medical aid, pet insurance? That is something that has really, really come a long way, because this is your peace of mind. Should something happen, then they will help you to cover the costs. There are some medical aids that will pay your vet directly, and there are some medical aids that you will have to pay first, but then they will pay you back within 2 weeks' time or so. So that is a huge help for majority of our clients that we see.
So in terms of looking, obviously we do not make recommendations on medical aids. It's an agreement between the pet owner and the insurer.
Absolutely.
And as a sort of third party, we're very sensitive about not saying essentially who to go with.
Yeah.
But in terms of advising your clients, are you just saying make sure that you make an informed decision, look at the small print? How do you go about choosing that policy? Is it based on the number of pets that you have, or affordability, or how would you look at a policy?
Look, at the very least, your pets should have an emergency cover, accident plan, and it is very affordable. But when you're looking at other options, they're not a lot more expensive than the very basic plans. And you can always consult your vet in terms of breed-specific problems and what they allow when they come for a vaccination as a puppy. Ask what problems they will potentially have, because there's obviously familial predispositions and breed-related issues. For example, if it's a small dog, it's likely to develop dental disease. So then get a plan that will cover dental treatment, dentistry. If it's a large dog, then it's highly likely that it will get osteoarthritis. Then get a plan that will cover chronic plan. If it is any brachycephalic breeds, then put them on premiums, because they will have lots of problems with their health because of inbreeding and selection. And they just need to be on premium plan. But look at the fine print and look at, especially at the sublimits, what they cover, because some medical aids don't like covering diagnostic workup. They just don't. They want a diagnosis. They work on, as in human beings, they are ICD codes. We don't have those ICD codes. It's virtually impossible sometimes to make a diagnosis without diagnostic workup in an animal, and that's part of the biggest cost sometimes. So, and some medical, and then you have to just look, that they will cover not only for emergencies, not only for hospitalizations and some simple stuff, but for diagnostic workup as well. And then obviously those fine print with hereditary problems that they will not cover. If you think about it, almost any disease, chronic condition, or a problem that just comes up in a young age, it's hereditary, or there is some familial predisposition to it. So, like in human beings as well. So you just have to look at that fine print and then make sure that you are making an informed decision and manage your expectations.
No, that's really good advice. Yeah, often, it's very difficult to get involved at the point where people are wanting you to sort of motivate for an insurance claim to be paid. And it's, like I say, we really are very sensitive about trying to remain neutral parties in insurance discussions.
Yeah.
But obviously now, when people are under financial pressure, to be able to have the ability to just do that a little bit more for their pet when they can't afford it, it helps. It helps everybody involved.
And they often get upset because they already have pre-existing conditions, and then when they come and they say we can't afford it because our medical aid will not cover it, or it's not my while to start with medical aid because now my animal does have pre-existing conditions that I'm going to spend my money anyway on. So, and there is a breakthrough product on the market that will cover for pre-existing conditions. You just need to inquire it from your vet, and you just need to look harder, and you will find plans that will start covering your pet for pre-existing conditions only in a month's time.
That's very good.
So that's very helpful as well.
And some of noticing now, even with certain brands, they're putting in place medical aid for emergency cover. I know UltraPet, for example, have, if you buy their food regularly, they have an accident cover as part of just no additional cost. So even if people are not in a position to pay for a policy, making decisions to just have some basic cover, like you say, even in the event of an accident, just to have some help, because I think that's when we find, people are just mostly put out, like to come up with, 5,000-10,000 rand for a laceration, or puts a big sort of pressure on.
And it speaks a lot about the volume about the brand. That means that the brand is really taking care of the patients, and their clients and their customers. Their customers are dogs and cats.
It's great. So I think medical aid in general, and I really like your advice on sort of, especially understanding based on the breeds or the animals that you have, understanding the pre-existing conditions and the hereditary problems in particular, and having that discussion with your vet. So a lot of it is good communication and like you said, making that informed decision when it comes to which policy and why, and then not going, they haven't had any problems for the last 5-6 years, and then discontinuing that's the other thing I come across, discontinuing the insurance policy.
They discontinue the insurance policy, and then in a month's time, Murphy's Law, they get sick. So don't do that.
So back to, I just want to also, in terms of veterinary care, are there any misconceptions that owners have when it comes to veterinary care? You mentioned before that perhaps people think that it's when offering something different to a hospital. You described everything sterile. We're sourcing the things probably from the same suppliers. Why is it that, do you think that owners don't understand?
Misconception of veterinary costs, I assume you're talking about.
Yes.
Okay. So people love doing shopping. So they will get the quotes around certain vets in the area, for example, for abdominal ultrasonography. And those quotes or estimates, as we say, they can be quite different. So then they start questioning, why is it different? Is one vet is greedier than another one? So I will go for the cheaper one because, I mean, it's the same service, isn't it? But they don't understand that it's not the same service. Because having a very old machine with lower resolution, without a Doppler, without special probes that will make a better diagnosis, and as opposed to having a top quality equipment and state-of-the-art expensive equipment that hospital possibly is still paying off, then having an ultrasonographer that has basic skills and good enough luck to find simple problems or pregnancy scan or a stone in the bladder, that's good enough. But when it comes to the overall many conditions that may be found in your pet, and then when you compare the studies of ultrasound from one operator to another operator, it is very much it's experience. It's you're paying for expertise, you're paying for equipment, and you're paying for diagnosis. So at the fraction of the cost that you will save, you might get a different outcome. So you're paying for what you're getting basically. Yeah.
And I mean, I love the fact that you tapped into how important getting the right diagnosis is. So, and the fact that perhaps some insurance policies do not cover that workup. Talk to me about why getting a diagnosis is important and how we go about it. Because obviously, you know, I have a sore elbow or whatever, I go into my GP who perhaps operates from a room with them without the requirement of them having an ultrasound machine or bloods or whatever. They will send you somewhere else to go and get that kind of workup. We obviously have it under one roof within a veterinary practice, which obviously adds to its cost. But let's talk about, you know,
the breakdown of costs and misunderstanding.
Absolutely.
So often people compare, you know, oh, my GP vet is less expensive than my vet. It's shocking. And if you compare once again, when you go to a GP veterinary practice, there's just a few rooms normally, receptionist and a few doctors, maybe a nurse, and that's it. There's no any other costs that they need to cover. You pay for a consult, then you get a script, then you go to the pharmacy, then you fill the script, you pay dispensing fee at the pharmacy, you pay for the medication that you bought. They send you to the lab, they will send you to the someone who has ability to do the imaging. They will send you to imaging department to do the scans, as you mentioned, or an X-ray or a CT scan, and then that all then comes back to you separately. So when you go to your GP vet, you pay for a consult, but then later on you pay lab fees, you pay pharmacy fees, and at the vet, normally when you go to the vet, your GP vet will run the test straight away under one roof in-house, and it will dispense the medications mostly out of their own pharmacy. Yeah. So then you get a bill, and then you look at it, and it looks like a lot. But if you break it down, it's actually not.
No, I feel the same. It's quite frightening for owners, but it's all under one roof, which is obviously a wonderful.
It's a comprehensive care. It's a comprehensive care,
and it's great that it is under one roof, because it means there's no delay and there's no sort of time frame of sort of having to wait for a referral appointment, or wait for the pharmacy to open. If it's in the middle of the night, you dispense medication immediately, and that makes quite a difference. Okay, Dr. Arina, let's take a break.
Okay.
And we'll be back for part 2 where
Sure.
we're going to discuss some things in great depth.
Okay.
Thank you.
Thank you.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.